Good evening. My name is Summer Vinson, and I'm going to be doing my presentation for the disease project. I did mine on toxic shock syndrome. The pathogenic organism is Staphylococcus aureus, and it's a bacterium. How Staphylococcus aureus can be cultured and isolated is through culture media, a blood agar, and it can be grown at temperature range between 15 degrees and 45 degrees Celsius. It can be isolated by clinical specimen, which can be stored. It should be stored at negative 80 degrees Celsius. The specimen is sensitive to acquiring mutations if it's not grown, isolated, or stored properly and at the proper temperatures as well. How it's acquired. Vaginal cytokine responses may originate in the epithelial cells of the vagina. So, that's how you would get it from a tampon, is through the epithelial cells of the vagina. It can be transmitted by having personal contact with items that possess the germ, such as towels, clothing doorknobs, and then also skin-to-skin contact. And if you have a break in your skin, like a cut, abrasion, pimple, cyst, something like that, you can also contract it that way. My sister got staph because her boyfriend had it in his tattoo on his arm, and since they held hands like this, she got it in her arm where she actually had, you couldn't see anything, but it was a little scrape, and she contracted staph, which is what Staphylococcus aureus is. It's kind of like a staph infection, or it is. It shows in different ways. With toxic shock syndrome, it is life-threatening, and it does cause certain types of bacterial infections. The mechanisms by which cause the disease, it's often a result of the toxins produced by the Staphylococcus aureus, but it's also associated with having viral infections like the flu, chickenpox. So what happens is the bacterial toxins act as super antigens, and they activate the T cells in very large numbers, and that generates an overwhelming immune-mediated cytokine avalanche, and that's how it presents as symptoms. And the symptoms would be a sudden high fever, low blood pressure, vomiting, diarrhea, a rash that resembles a sunburn. It's mainly in the palms of your hands, the soles of your feet. You can also get confusion, muscle aches, redness of the eyes, mouth, or throat, and it can cause seizures and headaches. And it can affect anyone, including men, children, and also women that, have gone through menopause already. The risk factors would include skin wounds, surgery, and use of tampons and other devices like menstrual cups, contraceptive sponges, that kind of thing. So how you would diagnose toxic shock syndrome is a doctor would perform a vaginal, cervix, or, throat, mouth swab. And they would also obtain a urine and blood sample. And they would send those samples to a laboratory and get them tested and analyzed to determine if the bacteria was present. And you may have to do some other testing as well to see if it's affected your other organs, like a CT scan, a chest x-ray, lumbar puncture, and that'll also help determine the extent of the illness, how bad it is. Treatment would include antibiotics, receiving medication to stabilize the blood pressure issues, an IV fluid, to treat the dehydration. You'd also receive supportive care to treat other signs and symptoms of the disease. You'll likely be hospitalized if you acquire toxic shock syndrome, or develop it. Organs can be affected, like the kidneys and stuff like that. So if they are, then you might need extensive therapy for it. You may need dialysis and other things like that. So to prevent it, you would read labels on the tampon boxes and use them correctly. You would also try to use the lowest absorbency tampons as you can. And you would change every 4 to 8 hours, as it says on the box, sometimes, more frequently. Also, you should alternate between tampons and pads. Don't always use tampons, Use pads too. And if, you've got a light flow, then mini pads or panty liners would be better to use than using a tampon. I think that, tampons were used to go swimming with and get in water and stuff like that. And I feel like those are the only times that they should be used if you're really trying to prevent yourself from developing toxic shock syndrome. But if you do use tampons regularly, then just be sure to change them out and follow the instructions properly. Change things frequently. I obtained the information from websites such as Mayo Clinic, Medline Plus, which is the U.S. National Library of Medicine. I found a lot of good information there. And then also the National Library of Medicine, which is the NIH. It's the National Center for Biotechnology Information. And that information is actually approved by the government. The website's funded by the government, actually. So I found a lot of cool different things about this. I hope that this video was informative to anybody who watches it. If you're the teacher, I'm sure you know about it. But if anybody else watches it, I hope this video is informative and helps you out in some way.